toxic masculinity.
COVID-19 deaths dropped 20% in the past week.
Oh, that's shocking. Wow, that's fantastic news. Well, let's go ahead and have a look at this article now. The average U.S. COVID-19 death toll plunges even as new cases rise. That's interesting, and I think this probably has a lot to do with the vaccine. Yeah, I mean, I don't think that's disputed. The vaccine is a sort of miracle that we've been able to get in such a short amount of time. Thank you, Donald Trump. I know a lot of people are skeptical about the vaccine. My doctor was mad at me yesterday when I told her that you and I didn't get it and we're not getting one, and she tried to convince me that it was like this perfect thing.
Don't say that.
Honestly, I do think that it's a good thing. I think the vaccine works. I think it's safe. I think it's fantastic. But in our case, we have this weird thing where we don't seem to be able to get COVID. And we suspect that maybe we already had COVID.
I do suspect that.
Like 2019, like late 2019.
In November, somewhere in the end of that year.
Yeah, before we even knew that there was a pandemic. Because COVID was in LA earlier than like anywhere else.
September, October, it was already in LA.
So we suspect we caught it early because we've never been able to catch any strain of it. And you can catch it twice if you catch different strains and stuff like that. But it's incredibly rare. But my doctor was saying that like 2 of her relatives caught it twice. And I was like, wow, that's like really unlucky. That's bizarre to me. That's bizarre, but I guess that sort of thing does happen.
Something has to do with your immune system.
Yeah, well, I did because she's from Iran, and I said, do you think Persians have a particular susceptibility to it? Because I haven't read anything about that or heard anything about that, but I just asked maybe.
So the COVID is racist? That's what you
well, different people with different genetic makeups have different susceptibility.
Well, they already said
the
COVID was racist because black people getting more
right.
sick than...
Right. I mean, that's just it's just a possibility. It's like sickle cell anemia, right? I think isn't that right? Isn't that what black people get? I think black people specifically get sickle cell as like I think that's right. Maybe that's wrong. I don't know. Different races are more or less susceptible. Like Jews have certain susceptibilities.
Well, your doctor were encouraging you to get the vaccine.
Yeah.
Mine.
Oh, really? Was discouraging you?
He was like, I'm not even doing flu shots.
Well, one of my best friends is a scientist, and he does research into this kind of stuff, and he is 100% convinced that the vaccine is safe and effective, and everybody should be taking it. But he also says that if you've had COVID, that is actually the best vaccine. Like if you've actually caught COVID and recovered, then it's very unlikely you're going to catch it again.
It doesn't matter what they say. They're gonna force everyone to get a vaccine. If it's not gonna come through your employer, who will say you're fired unless you get a vaccine, then they will ban us from traveling if you don't have COVID passport. Whatever.
I mean, I'm not quite as cynical as Valeria is, but
guys, remember this. I'm sure in the end of this year, they're going to say, you all have to get a vaccine or you won't be able to travel. Just like mark this right here, okay? And then we will see what's going to happen.
Yeah, I don't think that's actually true, but Valeria does. I'm optimistic. She's cynical, so we'll see.
I'm a cynical, optimistic Russian bitch.
I think you're a cynical, pessimistic Russian. Thank you very much.
Yeah.
All right, let's move on. Let's continue to try to read this story here. We keep going on these tangents. They're a lot of fun, but let's try to get this story read. The average daily COVID-19 death toll plunged by nearly 20% over the entire U.S. over the past week, even as the average numbers of new cases and hospitalizations went up, officials said Wednesday, which doesn't make any sense because you'd think that the vaccine would just stop people from getting it at all. It's just kind of surprising that the deaths plummeted 20%. Maybe it's because they're better at treating the patients, but it seems like a lot, 20% in a week. Or maybe all the people that are most susceptible to dying of COVID have died. Maybe we hit that hurdle because you knew that was going to happen.
I don't even know what to say because I don't know what to say.
But that is a possibility. It's a kind of a morbid thing to talk about, but it is a possibility that everybody who was likely, or most people who were likely to die from COVID, have already died. Right? The most susceptible people have already died. Like very, very, very old people who are really out of shape and basically going to die anyway. Maybe they're all dead now. So it's COVID doesn't have such vulnerable people to attack maybe so much. That's possible. I mean, it's kind of unpleasant thing to talk about, but it may be true. Let's see. On average, 745 people died per day between March 30th and April 5th, down 19.7% from an average of 928 people during the previous week. That is still quite a lot. But what you have to think about, by the way, is that not all of these deaths are of COVID. They're just people who died who also had COVID. So if you get in a car accident and you die and you test positive for COVID, they still count that as a COVID death. It's very weird. I don't know why they do that.
Why they didn't count George Floyd death as a COVID death? I don't understand.
I know.
Sorry, I'm gonna always bring it up.
All right. Right. The decrease in fatalities came as vaccine rates continue to ramp up across the nation, with around 3 million people now getting shots per day in the U.S., she said. That's a weird way of putting that. I'm encouraged by the decreased number of deaths, Walensky said. While these rates of vaccinations are incredible and so encouraging for all of us, trends are increasing in both case numbers and hospitalizations. I don't understand. Well, that doesn't make any sense. It doesn't make any sense. As people are getting vaccinated, we're getting an increase in hospitalizations? I don't understand that. Maybe somebody in the comment section can make that make sense for me. That doesn't make any sense.
Side effects?
Side effects from the vaccinations, you think? No, I don't. Maybe. I don't know.
Catching COVID from vaccine?
I don't think you can catch COVID.
Some people get test positive after a vaccine.
Yeah, maybe, yeah. Okay, the average number of daily coronavirus cases grew 2.3% from last week to this week, according to CDC data. The average number of daily hospitalizations also increased by 2.7%. That's crazy. Walensky attributes some of these cases to younger Americans, many of whom are among the last in line to be vaccinated. Across the country, we're hearing about virus clusters associated with daycare centers and youth sports. Hospitals are seeing more and more younger adults, those in their 30s and 40s, admitted with severe disease. We must continue to vaccinate as many Americans as we can. Recent data from Johns Hopkins University shows that nearly half the nation's new COVID-19 cases are concentrated in U.S. 5 states. You mean in 5 U.S. states? Why is this person writing everything backwards? Who wrote this?
Who wrote this?
I always want to see the... Natalie O'Neill. Natalie O'Neill? Be better at writing. It's not terrible, but there's some kind of weird stuff. Concentrated in U.S. 5 states. That's 5 U.S. states. Come on. Easy. Including New York, which had the most new infections across the country last week. A Democrat state, might I add. As of Wednesday, 76% of seniors and 80% of teachers or child care workers had received at least one vaccination shot, she said. Overall, 32% of adults in the U.S. have received at least one shot, according to the CDC data tracking website. More than 556,000 people in the U.S. have died of COVID. That is quite a lot of people. That is a lot of people. All right, let us move on to the next story. I mean, it's a little bit of like a bittersweet story. I mean, it's good news for sure, but it's a little confusing. I don't really understand.
Chris, I'm gonna tell you, I was confused from the beginning of last year.
Yeah.
When they start this whole COVID.
Yeah, well, I mean, a lot of the data has been confusing, I think, because, partly because of the way that they track COVID cases or COVID deaths specifically. Like I was saying, the idea that they'll consider you a COVID death if you die with COVID as opposed to dying of COVID. I've never understood that. That doesn't make any sense to me. It's a terrible way to count these things, and it's actually a more problematic way to count these things now that we're recovering. Back when we were at sort of the height of the pandemic, it was just a way to increase the hysteria. But now that we're recovering, it's actually critical that we know.
I don't think.
Let me finish. It's now that we're recovering, it's critical that we know precisely how many people are dying of COVID, and we know precisely how many people are actually, what do they call it, intubated, or people who are in hospital because of COVID. Because a lot of times you may be in the hospital for some other reason, but have COVID, and they're like, this person's been hospitalized with COVID, and it's like counted in the same group as people who are hospitalized because of COVID. And I don't know if they're doing that, because if they're counting a death with COVID in the same pool as people who are dying of COVID, then I'm sure they're counting the people who are hospitalized with COVID as being hospitalized in the same pool as people being hospitalized because of COVID. And I think that's a horrible mistake.
I don't think the plan was to increase the hysteria.
Right.
I think the plan was like this. Okay, just in case, we will count this death from COVID if it tests positive for COVID. Because if things are that bad, it's better to make them look worse than actually is. Because if people will find out that we were hiding numbers,
right,
trying to be accurate, but actually is
they're trying to be conservative about it, you think?
Yes.
Well, I think there's probably both factors. I think that people liked high COVID numbers so they could increase the hysteria, and I think that people were afraid of estimating too low. I think you're probably right. But I do think there were some people who benefited by stoking hysteria,
100%.
especially the news media and politicians.
100%.
But I don't think the medical community was doing it in particular for nefarious reasons. I think probably that's why, like, maybe a doctor would.
How much money you will get from government if you will increase this hysteria? If you're like a clinic, a doctor, you will get more money coming in from the government.
There were certainly stories about that, how people would get more money for. I didn't know exactly how that worked. I mean, I read stories about it, but I don't remember. It didn't make sense to me that people were making money.
People were working overtime. People getting paid. Well, everybody made money. Everybody made money. Everyone.
It's weird. I mean, well, like the Democrats always say, they never let a crisis go to waste. All right, let's move on to the next story, darling.
Intelligence is a white man's mythology.
Yeah, this is a weird story. By the way, Valeria is going by her supervillain name today, Two-Face. Anyway.
Sorry, you mean because of this?
Stupid joke. Yes, that's why. That's what I meant. Yeah. Oh, beautiful. Hideous. No. All right. Let's have a look at this. This is essentially a story about a crazy person. Like, this is one of these lunatic leftists who are, like, legitimately crazy. So let's have a read here. University researcher says intelligence is a white man's mythology. Now, this is a tweet. I mean, I don't know if this is newsworthy, but it's definitely bizarre. And just another example of how crazy the world has gotten. Toxic Masculinity. Weekdays, 9 p.m. Eastern, 6 p.m. Pacific.